Have you ever wondered why the human body sometimes seems to turn against itself, causing discomfort and pain? Today, we dive deep into an intriguing medical phenomenon known as inflammatory bowel disease, or IBD for short. Inflammatory bowel disease represents a group of intestinal disorders causing prolonged inflammation in the digestive tract. It's an umbrella term housing two primary types: ulcerative colitis, which causes long-lasting inflammation and sores in the innermost lining of the large intestine and rectum, and Crohn's disease, which is characterized by inflammation of the lining of the digestive tract, which can often spread deep into affected tissues. What causes these conditions, you might ask? Well, the exact cause remains unknown. However, an abnormal immune response seems to play a critical role. In IBD, the immune system mistakenly attacks cells in the gastrointestinal tract, causing inflammation. This immune system malfunction could arise from genetic factors or environmental triggers. Symptoms of IBD can be quite debilitating and significantly impact quality of life. They typically include severe diarrhea, abdominal pain, fatigue, weight loss, and malnutrition. It's important to note that the intensity of these symptoms can vary from person to person and be influenced by the location and severity of inflammation. Now, shifting gears to treatment. Management of IBD primarily aims to reduce the inflammation that triggers your symptoms. This not only alleviates symptoms but can also provide long-term remission and reduce complications. The first line of treatment typically involves anti-inflammatory drugs such as aminosalicylates and corticosteroids. For those who don't respond to these, immune system suppressors become the next line of defense. They work by curtailing the immune response that triggers inflammation. In severe cases, surgery may be necessary, but remember, each patient is unique and what works for one may not work for another. Therefore, a patient-centric approach is critical when dealing with IBD, taking into account the specific type of IBD, severity of symptoms, and the patient's overall health status. To recap, inflammatory bowel disease is a complex and often debilitating condition brought about by a misfiring immune system. It manifests in two primary forms: ulcerative colitis and Crohn's disease, with symptoms ranging from severe diarrhea to malnutrition. Treatment is centered around reducing inflammation and managing symptoms, using a combination of anti-inflammatory drugs, immune system suppressors, and in some cases, surgery. Understanding inflammatory bowel disease is crucial, not just for those affected, but for everyone. Knowledge is power, and the more we know, the better equipped we are to support those living with this condition. So, the next time you hear about inflammatory bowel disease, you'll have a clearer picture of what it really means.